And I think we're going to have you, just give some highlights in the equine world. You've seen it with canine as well. So maybe you could just talk through some of the ways that in your practice you have used Summit.
I also told them that you've never paid for a single one of them.
Oh, anyway,
So
we started using Summit very early on. And originally we used it as sort of our maintenance protocol for all horses that were competing. So, we know that as you're competing, you're wearing and tearing on your joints, just like athletes, human athletes, canine athletes. Like it doesn't really matter if they're athletic, they're going to be, you're doing things that your body is not necessarily designed or built to do. So there's going to be wear and tear. So we started with it on a monthly, we did the loading series. And then we did it on kind of a monthly basis for most of the horses in my practice. And we started using it as a replacement for the other supplements that are out there that are injectable.
You can say them.
Okay. Well, Adequan and Legend. I didn't want to
You're not saying anything bad about them. I mean, we don't never badmouth the competition.
No. We started using that as sort of our replacement. And we found that from client feedback and from my feedback for, a lot of these horses we started on, I had them in my practice for 8 years or so. I knew their injection schedule as far as their hocks are done this many months, their stifles are done once a year. Like I had them in my practice for a long time. So I knew them very well. And these horses started going months past their due date or, kind of when we expected them to come up to have their issues. And, with the other products out there on the market, we hadn't had that experience. So,
can I tell a true story?
You can tell a true story.
So when we started seeing how much further it was pushing the joint injections back, like she makes a lot of money doing joint injections. It's a little $33 vial of Summit.
Our practice is 50% lameness sports medicine stuff. Yes.
Yeah. So she makes a big chunk of our practice. Hundreds of thousands of dollars a year in joint injections. And all of a sudden, the 6 month or 8 month joint injections are going to the 12 to 14 month joint injections, and we're losing our shirts on this. And I went to her one day, I said, listen, can I just sell this to everybody else and you not use it in your practice? Because this is going to hurt. So true story. That actually happened.
That discussion actually happened. And it is true. It did change our margins as far as, our profit margins, but we were happy that we didn't have to continually inject horses with steroids because we all know that, detrimental effects of steroids long-term use in joints and for the cartilage. So that's kind of where we started. And then we started using it, that we came up with the IA injection. We're thinking, well, if it's that great in the IM realm, then maybe if we put it directly into the joint. And Dr. Hausman had given us a bunch of research of how in the laboratory, it actually repaired cartilage, which most of the things that we put into the joint don't actually do that. They either preserve what we already have or as steroids, degrade the cartilage. So we started using it in that respect. And then we found out that even extended them even farther out from their times that they would need their joint injections. But, horses are unfortunately a job security because they always manage to find a way to hurt themselves in other ways. So, so we were okay with that, but we were really happy with the results and really surprised at how well it worked and how much it extended the life of what we did, as far as both the IM and the IA version, so that these horses were healthier, they were happier, they were more comfortable, and they were still doing their jobs. They were still performing at the level they had been at, and they were still, doing very well in response to that.